Hello everyone, my name is Murtaza Juzar Salawala, and in this video we will learn about AntiAmoebic and AntiProtozoal drugs. We will learn about drugs for giardiasis, drugs for trichomoniasis, drugs for leishmaniasis, combination therapy, HIV and leishmania co-infection. The classification of drugs. The classes of drugs used for giardiasis and other organisms are nitroimidazoles, alkaloids, chloroquine, amides, antibiotics, and 8-hydroxyquinolines. The mechanism of action. Ultimately, all the drugs inhibit protein synthesis by different pathways. Drugs for giardiasis. Giardia lamblia is a flagellate protozoan which infects children and adults by orophycal contamination and mostly lives as a commensal in the intestine. It sometimes invades the mucosa and causes acute, watery, short duration diarrhea with foul smelling stools, gas, and abdominal cramps. If untreated, it may pass on to chronic diarrhea with greasy or frothy stools but no blood or mucus. Many drugs useful in amoebiasis are also effective in giardiasis. The drugs used are metronidazole, dose 400 mg 3 times a day for 5 to 7 days or 2 gram daily for 3 days. Tinidazole 0.6 gram daily for 7 days or 2 gram single dose. Sesindazole 2 gram single dose is enough. Nitazoxanide 500 mg twice daily for 3 days. Quindochlor 250 mg thrice a day for 7 days. And furazolidone 100 mg thrice a day for 7 days. Drugs for trichomoniasis. Trichomonias vaginalis is another microaerophilic flagellate protozoan which causes vulvovaginitis. It is a common sexually transmitted disease affecting approx 10% sexually active women. Several drugs are partly effective by vaginal application but may not entirely clear the infection. Recurrences are frequent. Repeat courses are required of the drugs. The drugs used orally are metronidazole 400 mg thrice a day for 7 days or 2 gram single dose. Tinidazole 600 mg daily for 7 days or 2 gram single dose. Sesindazole 2 gram single dose is enough. Drugs used intravaginally: diiodohydroxyquine dose 200 mg inserted intravaginally at bedtime for 1 to 2 weeks. Quindochlor 200 mg inserted in the vagina every night for 1 to 3 weeks. Povidone iodine 400 mg inserted in the vagina daily at night for 2 weeks. This form of dosage form is also called pessaries, which are inserted in the vagina. Drugs for leishmaniasis. Leishmaniasis is transmitted by the bite of female sandfly phlebotomus. In the fly, the parasite exists in the flagellate extracellular promastigote form, while in man it is found only in intracellularly within macrophages in the non-flagellate amastigote form. Mucocutaneous and dermal leishmaniasis are caused respectively by Leishmania brasiliensis and Leishmania tropica. Visceral leishmaniasis is fatal unless treated. The drugs used are amphotericin B 15 mg per kg for 3 to 5 days oral. Miltefosine 100 mg per day, 2 times a day oral. Paromomycin oral 500 mg thrice a day for 7 days. And sodium stibogluconate is another drug which is no longer effective in Bharat as it shows resistance. Combination therapy. Like in case of TB, leprosy, HIV and malaria, combination therapy with two effective drugs has several advantages in the treatment of visceral leishmaniasis. These are limiting risk of development of drug resistance, thereby prolonging the effective lifetime of available medicines, attaining higher efficacy and cure rate, shortening of duration of therapeutic regimen, better compliance and convenience, reduction of overall dose, lower toxicity and cost. Clinical studies in India have testified to the high efficacy of drug combinations and have shown that duration of treatment can be reduced by half or more. The three combinations tested were amphotericin B 5 mg per kg IV single dose plus miltefosine oral daily for 7 days. Second combination amphotericin B 5 mg per kg IV single dose plus paromomycin intramuscular route daily for 10 days. And third combination miltefosine oral route daily for 10 days plus paromomycin intramuscular daily for 10 days. Each of these combinations yielded 98 to 99% cure rate. As such, these combinations are recommended with high preference by WHO. However, cost of amphotericin B, even single dose, is very high. Another topic, HIV and Leishmania co-infection. HIV and Leishmania infections worsen each other. In endemic areas, HIV positive subjects are more likely to develop visceral leishmaniasis, harbor higher and disseminated leishmania load, and have poor prognosis. Similarly, occurrence of VL in a HIV positive subject is regarded to be a sign of AIDS and warrants intensive therapy. Co-infected patients have a poor response to anti-leishmania as well as anti-HIV drugs. Therapy of such patients is difficult and mortality is high. Quiz time. Which is a tissue amoebicide? Answer is C. Chloroquine. Which drug is used intravaginally to treat trichomoniasis? Answer is D. Quindochlor. Which drug causes premature termination of translocation? Answer is C. Paromomycin. Which drug is not used in Bharat for leishmaniasis? Answer is C. Sodium stibogluconate. Which another disease is usually associated with leishmaniasis? Answer is B. HIV. Thank you.